So they've thrown massive resources at it.
The therapy is called Satricel from Karsten.
Correct. It targets a protein called Claudin 18.2. Now, for patients with end-stage gastric cancer who have failed chemotherapy, the options are usually non-existent. You're essentially looking at palliative care.
And Satricel changed that. I'm looking at the numbers. 3.25 months progression-free versus 1.77 months. I had to play devil's advocate. Adding a month and a half doesn't sound like a miracle.
I hear you. And to a layperson, those numbers do look small. But you have to understand the context. These are end-stage patients with rapidly aggressive disease. Doubling the stability time is massive. It validates the target. It proves CAR-T can work in a solid tumor. It stops the decline.
Okay, so it's the proof of concept that opens the door. It's the first foot on the moon.
Exactly. But if you want a wow number, something that really jumps off the page, look at liver cancer. The therapy is CCRR031.
From Ebelzeta. This uses what they're calling armored CAR-T technology. Armored, like it's wearing a shield.
In a way, yes. You have to imagine a solid tumor as a hostile environment. It's not just a lump of cells, it's a fortress. It secretes chemicals that actively shut down the immune system. One of the main culprits is something called TGF-beta. It basically tells the T cells to go to sleep.
So the T cells show up to fight, the tumor sprays this chemical, and the T cells just turn off.
Right. This CAR-T is engineered to block that signal. Think of it like a gas mask. It has armor against the tumor's suppression tactics. It stays awake and it keeps fighting.
And the result? I'm seeing a 90.9% tumor shrinkage rate.
In liver cancer, that is unheard of. We are used to seeing drugs that maybe slow growth or shrink tumors by 20–30%. To see over 90% shrinkage in a cell therapy trial, that demands attention. That changes the entire paradigm.
It really highlights the disparity. If you have liver cancer in 2026, the best technology isn't in Houston, it's in China. But they aren't stopping at cancer, are they?
No, and this is the new frontier for 2026. Autoimmune diseases, specifically lupus or SLE.
This is fascinating because it's a completely different mechanism. We're not killing a tumor, we're trying to reboot the entire system.
Exactly. The hypothesis is an immune reset. In lupus, your B cells, the cells that make antibodies, are malfunctioning